Today we're going to be showing you how to put patients in position on an exam table. The positions that we generally use in the healthcare setting, ambulatory healthcare setting, are the Fowlers, semi-Fowlers, supine, prone, lateral Sims either left or right, and the dorsal lithotomy used with gynecological type exams. Generally, when working with patients and getting them into position, we don't expect them to jump up on the table and assume the position right away. Again, maintaining patient safety is paramount. So the first position we usually get our patients in once they're on the table is what we call the high Fowlers or Fowlers. We can have the patients scoot back, and then we can get them into a supine position from here. It's much easier to control the movements of the patient as long as we're dictating how we move the patient on the table. Right, Ms. Sarcel, if you scoot back. Actually, the hardest part of getting patients set up in positions is keeping the drape where it's supposed to be. So sometimes you can even have your patient kind of take that responsibility and make sure the drape moves with us as we go. All right, we're going to put her in the supine position now. So if you would go ahead and lay back. There you go. Most people forget about the footrest down here and have their patient's legs dangling. It's not real comfortable, especially if patients have back injuries or back problems. All right, so now we're in the supine position. Again, I'm controlling her. If we need to put her into the lateral Sims, one side or the other, then we can adjust her while on the table rather than risking our safety or their safety. I'm going to put her in the left lateral Sims, which means she's going to be laying on her left side. So I'm going to have her reach over and feel the edge of the table and scoot toward her hand. If you would, scoot. Okay. Now if you would, go ahead and take my shoulder and let's roll you on your side. 1, 2, 3, roll. There we go. Now you see I'm supporting her and helping her, and whatever's comfortable for them, we kind of create a kickstand with their leg, and now they're in a position for whichever examination or procedure needs to be done. If we need to roll her into the prone, which means they're on their tummy, we would have her scoot a little bit more toward her butt so we can roll her over onto her tummy. But since she has a sore back, we're not going to put her into that. But she would scoot this way and then finish the roll toward her and lay on her stomach. If we need to get her back into supine for another position, go ahead and move toward me if you can. Okay, and then let's reach back with your hand and feel the edge of the table as you go. There you go, and kind of scoot out. Okay. Let's pick. Okay, there we go. Yeah. The drape again becomes the hardest issue. If we're going to set them up to the dorsal lithotomy, these stirrups are underneath here, so we pull the stirrups out from the side of the table. Okay, let me put this foot up in the stirrup over here. There you go. And raise this foot and put it in the stirrup here. Now, I'm not going to profess to be the expert on this position. Ladies, you know how your gynecologist gets you into this position, how it's done. But basically, we don't want them dangling their feet. We want to go from one supported position to another supported position. Now, she's in kind of a low dorsal lithotomy. Depending on the physician, he may want the knees raised up a little bit more, which means you'd have to shorten the stirrups to get them into the position the physician wants. Okay, once out of this position, you know, again, we would support. Okay, go ahead and support. There you go. And now we're back into a position. A patient's been laying on the table for a while. We don't want to get them right up off the table. You know, the blood pressure changes. We don't want to have a syncopal episode that may cause them to pass out. So the first thing we're going to do is have her sit up. Go ahead and take my hands and sit. Now I'll have her sit here a little bit, probably take her pulse to make sure that her body's compensating for this change.
A little dizzy.
Hmm?
A little dizzy.
Yep. So she's a little dizzy, so I don't want to get her right up off the table and get her there. But I will continue to monitor her pulse. If I need to, I'll take a blood pressure until we get her back into the range she initially came in on. Okay? How you doing? Still a little dizzy?
A little bit better, but still a little woozy.
You been drinking?
No, but my blood pressure was really low today.
Yes, it was. Once her head is cleared and we can get her up, then we'll take her off the table and set her into the chair. Thank you.